Today we're taking on 10 of your most annoying problems and bringing you double the solutions. Number 6 on our list is a problem that many Americans just want to put to bed for good.
You're snoring. Hey, you're snoring.
You guessed it, we're talking about snoring, and joining me to talk about a permanent solution to one of the most common and serious types of snoring is Dr. Relle. Welcome to the show.
Thank you for having me.
You know, snoring's so very common, not only annoying, but can cause a lot of health problems. So let's talk solution.
What I'm going to demonstrate here is a procedure that we do for patients with very severe sleep apnea who failed other medical or dental treatments.
All right, so walk us through what you do.
Well, basically, these are procedures that oral surgeons have done for many years to correct bad bites. All of the work is done from inside the mouth.
Wow.
We make delicate cuts in the bones, both the upper and lower jaw. It's a form of carpentry on the bones.
Okay.
And then both of the jaws are advanced. What this does is it brings the facial skeleton forward so that we can support the airway. Here's an example of how it's done. We use small titanium fasteners to set the bones. The operation takes about 3 to 4 hours. The patient recovery, time away from work, is about 2 to 3 weeks. And after about 2 to 3 months, patients can resume full normal activities.
So after the surgery, you can see that the mandible or jaws has come out a little bit so that the airway has opened up.
That's exactly right. And by bringing the skeleton forward, we bring the tongue base away from the back of the throat, and that's what opens the airway.
And in fact, Tim, you've had this done, right?
Yes.
How is the snoring?
I don't have a gray cloud in my head anymore. I'm not tired all the time. It's been amazing.
You know, and in Tim's case, he's doing this for snoring, but as Dr. Relle said, that with obtrusive maxilla and mandible, there also is a aesthetic component to it. So it's important to see his pictures before and after. After he had advancement of his maxilla and his mandible, you've seen a profile shot, a significant improvement.
Dr. Relle, thanks for sharing this one with us. And if you at home are suffering from snoring, obstructive sleep apnea, you need to talk to your doctor because it can lead to a lot of health complications. And obviously snoring is one thing that you can, or that can prevent you from a good night's sleep, but you all know it's not